My own personal belief is that we probably don't, because it is a low-key disease. I look at things like strokes and heart attacks and trauma and infectious disease outbreaks. They draw headlines, but you know, if you say that the incidence of diabetes has gone up 2% in the last year, that really doesn't get people's attention to quite the degree. If you said there were new cases of Ebola virus, for instance, that would, you know, one case of that would get you a lot more attention than thousands of cases of diabetes, but that's just how it is. Our incidence is just as high or higher than the national average, and our Native American population is at greater risk for developing the disease and the complications from that. Our resources for educating people with diabetes is limited to some degree by our geography. We have a number of communities that are remote and small, and so getting support for folks with diabetes is difficult to do sometimes in rural areas. In terms of chronic disease, diabetes ranks up at or near the top of a disease process that's going to affect a huge number of our country, and the numbers of those that have the disease seem to be growing over time. In the long run, that's the aim for control of diabetes is to prevent complications. We measure the control of diabetes by the amount of glucose in the blood, and over time, if it runs higher than average, your risk is greater for involvement of your eyes, your kidneys, heart disease, stroke, complications of your circulation in your legs, and that can lead to ulcerations and sores and significant problems down the line if it's not controlled. This program that I went through, the Better Choices, Better Health, allowed me to go both as a patient and a provider. I still to this day do take care of patients that have diabetes, and looking at it from both aspects allowed me a little broader view of things, that when I was merely prescribing treatment for diabetes, I didn't realize what it was like once they walked out the door and had to do all these things that I recommended. And so it was interesting to hear patients discuss what they took away from their encounter with their provider, and so I got to look at it from both sides, and that's not something I'd done historically. So that was my take on it, that it was a whole new outlook on what happens when you're in the patient's chair rather than the provider's chair.